So here we have a patient here who's in the preoperative holding area, and patient was having a lot of pain underneath the balls of the toe, specifically underneath the ball of the second toe and underneath the ball of the third toe. Tell me, what kind of pain were you having associated with this discomfort on the bottom of the foot?
Just walking, when I would put every step would be full pressure on it. And just the pain would spread into my toes, but my toes would curl up. And it's just the pressure that would spread across the foot, and the pain would be very centralized right there in the middle. But every step I take was always right on that spot. It's right in the dead center of where my foot lands on the front part of my foot because of my arches. So every step I couldn't avoid it. I couldn't avoid that spot at all because of location.
And we tried conservative care, we tried different padding, we tried different creams, we tried different shoes. So now we're at the point for surgical intervention. I'm going to numb you up here in a couple minutes, and then we're going to go in the operating room. And remember, you're just going to be able to walk right out of here. No screws, no plates. And I'll show you what this looks like in the OR too.
Okay, cool.
So these are the two little marks where I'm going to make it a little poke incision. And through those incisions, I'm going to be able to get to the neck of the metatarsal, which is the metatarsal on the second and the third. That's going to allow me to get in there with a rotating burr and make an osteotomy at the neck of the second and the third metatarsal. And in a second here, I'll show you what that looks like when we're making the cut in the bone. So you can see we have these two little poke incisions, one there and then one where my burr is. And what this little incision is going to allow me to do, here's the burr. You can see the burr, but we're going to go in here, find the neck of the metatarsal. You can actually see it on the x-ray here. Right at that second metatarsal, there's my burr. And I'll show you guys what this cut is like. So we find the bone, we find the flange from the metatarsal head, we go just proximal, and then we run our burr. And we got the patient under local anesthesia. How you doing there, sir?
I'm fine, thank you.
Yeah, patient doesn't feel a thing. Perfect. So the bone cut is done, and I will show you what it looks like on the x-ray. Are you able to see the x-ray from there? You can see this little white line at the neck of the bone, and I'll kind of distract the toe so you can see it a little bit better. But that little white line is our bone cut. So that's going to allow pressure to be taken off the bottom of the toe. We're going to do the same thing on the third metatarsal neck here through the incision right next to it. But that's how you do the bone cut. So we're halfway through the procedure. After the second bone cut on the third metatarsal neck, I'm going to bandage the patient up. He's going to be able to walk right out of here. And I'll keep you all updated with the follow-up. So through this other incision, I was able to make the osteotomy of the third metatarsal. And now you can really see the bone cuts we made in the necks of the metatarsals. There's the one in the second, and there's the one in the third. So we're all done here. You don't necessarily have to put sutures in these stitches, but I do. So I'll put two little stitches here, dress the patient up, and see him back in a week, and he walks right out of here. So here we have a patient who is now 1 week out from surgery. And again, this patient was having a lot of pain underneath the balls of the second and the third toe. These are the incisions. This is just a small little poke, one little stitch for each incision. And we're 1 week out of surgery. You can see there's just a little bit of bruising on the toe, but Otherwise, this looks great. There's no signs of infection. The patient has been walking on the foot in the post-operative shoe. Any pain when I move the toe?
Nope.
Any pain here?
Just down where you cut, but that's it.
And how's that feel when I'm pressing on the bottom?
That feels so much better than it did before.
Fantastic.
Because it was so sensitive under there before. It was hard to walk, and now I didn't feel that at all.
And how's it feel since surgery walking on it?
It's kind of different because I've kind of had to change almost how I walk because I've gotten so used to kind of walking on the side of my foot. I'm kind of retraining my foot to go flat again. So it's a work in progress.
Yeah. I don't continue.
I'm not used to walking flat-footed. I haven't for so long.
You're going to have to reconvince yourself to walk normal.
Yes.
Well, you're doing great, sir. We're going to put another wrap back on you. You're going to continue to keep walking and driving on this. Everything looks good.
Good.
So we're 5 weeks, 6 weeks? 6 weeks out from surgery. Oh, that's right, 6 weeks out. You can barely see the incisions, but there was one little stab here, one little stab here. Overall, how are you doing now 6 weeks out from surgery?
Everything has been going really good. The pain, like we were discussing, is gone now. I don't have that when he was pushing on it. I wouldn't be able to stand it before. There's no pain on the bottom. It shifted over, but I think that's the arches that I need to work on. But with the foot, being able to walk on it again like I do and flat-footed again, I haven't been able to do that in a long time, so it's been feeling really good.
Now, any pain like you were having before surgery when I'm pushing here on the bottom?
No, sir. Nothing at all.
Fantastic. And what was the surgery recovery like for you? Because we did the minimally invasive surgery. You were able to walk on it that day. Was that difficult for you?
No, not really, but I'm used to being on my feet, so I went right back to work right away. I'm on my feet running a lot all day long, and it was a little slower because of that, but with that, I mean, I still was able to manage do my job and get to and from work and do my job with minimal problems. So yeah, it was great being able to not having to take any time off.
Did you have to take any narcotics after the surgery?
You prescribed some. I took the antibiotic that you prescribed. You prescribed a pain pill. I never really took it. The only thing I've ever taken is Advil.
That's great. That's great you didn't have to take a narcotic for this after the foot surgery. Fantastic. Well, if there are other patients that have this problem, would you recommend this type of intervention with minimally invasive surgery?
Oh, definitely. I mean, it's of all the procedures I've had in my foot so far, this is the one so far that seems to be working that I can immediately tell a difference. So I would definitely recommend it.
Fantastic. Well, we really appreciate you sharing your experience with us.
Thank you.
My pleasure, sir. You look great.